Hello, my name is Chase. I'm a student here at ADU for physical therapy, and today we're going to be learning about the glenohumeral joint, specifically external rotation. The primary muscles involved with external rotation are going to be the teres minor, the infraspinatus, and the posterior deltoid. External rotation occurs in a horizontal plane around a vertical axis. While in a resting position with the arm at the side, external rotation allows for 60 to 70 degrees for range of motion, and when abducted to 90 degrees, allows for approximately 90 degrees of range of motion. One study suggests that the neutral position for the glenohumeral joint should be about 55 to 70 degrees of shoulder abduction, which would typically be in the scapular plane. This resting position, or neutral position, allows for the joint surfaces to move more easily and is a common position used by therapists during initial evaluations or during early treatment of patients. Okay, so I'm about to perform some passive range of motion for my patient. It's important that you have your patient supine, that you're facing your patient so you can tell to make sure they're not in any discomfort. For external rotation, we can keep her at a neutral position. Typically we want to be in about a 90 if we can get there with our patient, resting her arm on my leg, and then the elbow is going to be in a 90 degrees as well. The forearm is going to be in a neutral position, no supination, no pronation, and I'm going to be stabilizing her wrist to make sure she's not rotating. And all I'm going to do is I'm going to put my hand right on top of the joint so I can feel as I'm going through the range of motion, looking for that end range. Typically, you want to make sure you're getting into a little tissue resistance. That way you know you're making a change in the tissues. Just like that. And she's relaxed. I'm doing all the work. One study suggests that because passive range of motion is assessed by clinicians, that it is very subjective and might have a poor reproducibility effect. The study goes on to suggest that's why clinicians should also assess the passive range of motion in different elevation angles and elevation planes. Okay, so we're about to perform a posterior anterior glide. This is going to help increase glenohumeral external rotation. First things first, I want to make sure my patient is lying prone. I'm going to place a towel directly underneath the joint, right under the acromion process. What I'm going to do is I'm going to get in a staggered position. With my right arm, I'm going to provide a distraction, grade 1 distraction, and my left arm is going to go right above the joint, right below the acromion process. And my force, so because I'm stabilized the acromion with the towel, my force arm is going to go anterior medially because of the positioning of the glenoid fossa. So what we're going to do is I'm just going to have her do a little grade, as I have the arm relaxed right here, a grade 1 pull, and I'm going So today we're going to also perform some stretching techniques. There are several different types of stretching. We're going to focus on a static stretch. So what we're going to do is we're going to stretch our external rotator muscles, which are going to be the teres minor and the infraspinatus. So by doing this, because they're external rotators, we're going to perform some internal rotation. So a stretch we can do at home with my patient is I'm going to have them get a rope, a belt, a towel, anything like that. So say it's our right arm is involved. I'm going to position the rope, making sure my left hand is pulling my right arm up, and we want to make sure we're holding that stretch for about 15 to 30 seconds. This is a good stretch to do at home. The ACSM recommends 2 to 3 times per week, for more optimal being every day. The intensity needs to be until we find slight tissue resistance. We want to make sure that we're holding the stretch for about 15 to 30 seconds and then making sure we're going for about 2 to 3 minutes. And like I said, this is a static stretch. Okay, so for strengthening the external rotators, I'm going to be performing an isometric contraction. The way we're going to do this is we're going to position a towel in between the wall and my body, making sure my arm is in a neutral position. I'm going to have my patient contract, pushing their arm into the wall as if they were opening up a car door. This is a good exercise to perform when your patient is early in their rehab progression. The ACSM recommends performing 2 to 3 times per week. The intensity, it depends on how far your patient is in their rehab, but typically you want to work between 40 to 70% of their 1 rep max. There is no specific time of performing these exercises, but it is recommended that you take 2 to 3 minute break between each set and 48 hours rest in between each bout. And we want to make sure that we're performing 8 to 12 to increase strength. If we want endurance, we can work 15 to 20 repetitions for about 3 sets for each. Thank you, and I hope you enjoyed this video.